Welcome, future leaders of audiology, and welcome to Austin, Texas. Hope you're enjoying our heat that we're going to deliver to you this weekend. My name is Brad Shields, and I am the lobbyist for the Texas Academy of Audiology. I've been representing audiology for quite a number of years down here in Austin, and part of my purpose for this morning is to let you know a little bit about what it is that I do and how audiology is represented at the Capitol. Sorry I can't be with you in person this morning. As you're watching this, I'll be up in Washington, D.C., probably going to be there for about a week, so I was unable to be with you this morning. But nonetheless, I really appreciate you letting me send you this video and giving you my presentation this way. I want to let you know a little bit about what it is that I do for audiology, how audiology is represented at the Capitol down here in Austin, and perhaps a little bit about what you can be doing later on as time goes on. First of all, let me know that I do have other clients. I have a lobby firm here in Austin called Texas Legislative Associates. We have a number of lobbyists that work here in the firm, and we represent a variety of different clients that range from corporations with tax concerns, other healthcare providers. We represent certain municipalities and counties in their interests at the Capitol. So I just wanted to let you know that we do have other clients, and TAA is one of our most favorite, and certainly somebody that I've gotten to enjoy working with over the years. I guess I'd like to let you know, first of all, that the legislature just adjourned on the 1st of June. They left town a couple of weeks ago, and they were here for 5 months dealing with legislative issues. Now, I want to let you know that here in Texas, it's a little bit unique in that our legislature, due to the fact that this is listed that way in the Constitution, requires that our legislature meet for no more than 140 days every other year. So 140 days kind of works out to be about 5 months. And so that's a very short period of time for a legislative body to meet, consider bills, pass bills. And it's an excellent concept, in my opinion. The founders of the state, when they drafted the Constitution, they envisioned a citizen legislature. So it would be an elected legislator would come to Austin, would be here for 5 months, pass new laws, get their business done, and then literally go home and live under those laws for the next 18, 19 months as regular citizens, have jobs, and be part of their community. So I think that has worked very well for Texas, and it beats, in my opinion, the alternative of other states like California and New York and places like that have a full-time legislator. And those people are in session year in and year out all the time, and maybe taking off a few months here and there. But I would think that this system has worked very well for Texas. So as to what it is that I provide to you as future audiologists and members of TAA, I've got basically 4 responsibilities that I'm going to run through and let you know what they entail. But the first thing that I have to provide for TAA is what we refer to as eyes and ears. While you are back in your communities, in your professional practice, you need to know that what is going on in Austin and what bills are being produced out of the legislature, somebody is watching those and listening for those issues so that you don't have to. And so as part of the job of being the eyes and ears, literally during a legislative session, there'll be 7,000 bills that are filed to be considered. Now, certainly most of them don't pass, but that doesn't mean that we take them any less seriously. So our staff here, we will literally read the caption, which is the first paragraph of every single one of those 7,000 bills, and we will review those to find out whether or not they have a potential impact on one of our clients. So we'll read those captions, which describes what the bill does, and to determine whether or not it might impact the practice of audiology or healthcare or your patients. Once we've identified bills that may in fact be something that could be of interest, we would then put those on a tracking list, and we subscribe to a service that allows us to add bills to a tracking list, and then we can print reports whenever we want, and it'll show exactly where those bills are in the process and what happened to them within the last 24 hours or something like that. So our first job is to track bills that may be of interest to TAA and the practice of audiology, and do an analysis of those bills. We'll read those bills that look like they will be of interest. We'll read the rest of the bill. We'll take a look at the law that it's proposing to change. We'll do an analysis to see if this is actually good for the practice of audiology or your patients, or it's detrimental. And so we will act accordingly at that point. I think the next thing the second responsibility that I have for TAA is to be an advocate. And of course, once those bills have been filed and we've identified them as something we might be interested in, one of the first things that we do is we go by the office of the legislator who has decided to file that bill, and we'll talk to the staff, or we'll talk to the legislator as to where did this idea come from, who may have brought it to you, what is your intent, and we'll visit with him about those things, and then visit with members of TAA to find out if they have an opinion about it, or whether or not it's something that we want to suggest some changes to, or even support. So that's the first part of our advocacy. As those bills proceed through the process, they will get hearings before House committees and Senate committees, and that is your opportunity to bring in expert testimony, audiologists, members of the association, leadership perhaps, that will come down and will offer their testimony in front of the full committee when that bill is heard. And so we will arrange for the appropriate person to come down and provide testimony. Sometimes a bill won't require testimony. It's fine the way it is, and we'll just register our support or opposition to a bill after having talked to the other members of the committee to let them know what our reasons may be. But providing expert testimony is certainly one of the things that we do. I would also add that there are occasions where the practice of audiology or TAA may have some initiatives that they want to offer. Instead of just reacting to other people's bills, we may in fact have some bills of our own to suggest. You may remember a couple of years ago, your patients were having trouble getting insurance coverage for hearing devices for their children. And they were actually getting letters from the insurance companies, suggesting that perhaps a hearing device or a cochlear implant wasn't medically necessary, and that it might even, in fact, just be cosmetic. So TAA decided to get a bill filed in the legislature to mandate that insurance companies provide coverage for hearing devices for children. That bill was filed and worked its way through the legislative process, and we were delighted to actually have passed that bill. So all state-regulated health insurance plans now must cover hearing devices and cochlear implants for children. And now, for those of you who are taking this information as something good, please also understand that a large number of the insurance policies in Texas are regulated on the federal level. They're called ERISA plans. and they're exempt from state regulation because they're they're regulated on the federal level because they're self-funded and such. So our legislation does not impact those, but that perhaps is something for us to take to the federal level at some point. This session, we did have a follow-up initiative where we did find that people were going to their insurance companies to get coverage for the hearing devices. And in fact, they were covered, but the level of coverage may have been minimal. It may have been $500, $1,000 for a hearing aid or for a cochlear implant, and that's all that they would cover. And that there was, in fact, a product that you could obtain for that price. And that's fine. But there were some patients who said, in fact, we'd really like to purchase the more sophisticated brand, one that had better technology, and it cost significantly more than what the insurance coverage would cover, but the patient was willing to pay for the remainder out of pocket. When in fact there were some insurance companies that said, sorry, you're either going to take the one that we offer or none, and we will deny the claim if you don't take the exact product that we are suggesting. So we did file legislation this time. We referred to it as the Freedom of Choice in Hearing Aids, and it basically was a bill that would prohibit an insurance company from denying coverage or denying a claim based simply on the fact that the patient didn't accept the lowest product that they offered. So we offered a bill that said that the insurance company may not deny the claim if the patient wanted a more expensive product, but it also said that the patient would be responsible for the difference out of pocket. And so, and that this would not increase the cost to the insurance companies. We took this bill to the lobbyists for the insurance companies, the health plans, and after explaining it to them, they understood what our efforts were, and they agreed not to oppose the bill, which would have been problematic. That bill was filed by Representative Julie Johnson from the Dallas area. She served on the insurance committee, and this bill went through the insurance committee, and she did a fabulous job of presenting it. The bill passed out of the insurance committee unanimously. It passed out of the House of Representatives unanimously and went over to the Senate. But unfortunately, it got bogged down in the Senate and ran out of time. So this is a bill that we're going to have to come back and work with next legislative session. But we got a late start during this legislative session, and there wasn't any necessary opposition to the bill. So we certainly feel enthusiastic about getting it passed during the next legislative session. The third responsibility that I have for TAA is to act more as a reporter. And during the legislative session, those tracking reports that I indicated that I would create during the session, I would take that report and send it to the leadership of TAA to keep them abreast of what was going on. They could see all the new bills that had been filed. They could see the bills that were making progress and those that weren't. And my job was to provide them with legislative updates and updates as to what was going on in Austin on a periodic basis. And then finally, at the end of the legislative session, we presented a report to them on the final status of all bills that we were tracking, as to which bills finally passed and which bills did not pass, and which discussions would continue. There are some bills that are filed that don't pass. That's not really the end of the story. You know that the people that were behind it are going to be interested in filing again the next legislative session. So we'll have to enter into discussions with those folks to make sure that there's nothing objectionable in the bill. Or if there is a problem, perhaps we can compromise and work things out ahead of time before the next legislative session. So that's what we do after a legislative session is over. And then the fourth responsibility that I have for TAA is to deal with the regulatory agencies that pass the rules and regulations that you will have to follow when you are an audiologist. Now, you will remember perhaps a few years ago, and for many, many years, speech language pathologists and audiologists were all regulated by the same board. They had their own standalone independent board that the governor would appoint speech language pathologists and audiologists to that board, and they would discuss and pass the rules and regulations for the profession. A few years ago, the legislature was trying to do away with these small standalone 8 boards and consolidated a bunch of them into what is referred to as the Texas Department of Licensure and Regulation, TDLR. And we were moved over, the speech language pathologists and the audiologists were moved over to TDLR. Their law moved over there. The independent standalone board went away. And the TDLR replaced that with a speech language pathology audiology advisory committee. And these are people who are appointed to the advisory committee by the TDLR. And whenever they're discussing proposed rules and regulations that impact SLPs or audiologists, that board meets and will consider them and provide input and comment to the full TDLR executive commissioner and their board. This is an important process that you must remember to participate in. Whenever bills are passed over at the legislature goes home and everybody kind of turns away and goes for a break. But you have to remember that those bills will now travel over to the agency for that staff to write rules and regulations to implement that legislative initiative. So it's my job to go with the bills over to the agency, to sit down and meet with the staff that are going to review it, make sure that they understand the legislative intent. They need to know that there's a difference between a may and a shall when it comes to law. And so we sit down with the staff over there. We explain the debate that went on, the amendments that were considered, the intent of the legislators, so that when they write the rules and regulations, they will tend to get it right. I often tell folks that if you don't take care of this process, they will write rules and regulations perhaps based on a different understanding that the legislature had. And once those rules are written and proposed, then you have to try to reverse it. And so it's a lot harder to correct errors than it is to get it right the first time with a little bit of input from us. So that's the time that we spend over at the agency visiting with the staff once the bills are passed and the rules are written. Now, as for this legislative session, I said that I wanted to update you a bit on the bills that passed and failed this session. And so I'm going to run through a very short number of them, but I think you might find them of interest. These are the kinds of bills that we had to deal with for the profession. These are the 4 bills that I'm going to share with you today that passed the legislative session, and you'll find that interesting. But there was a House Bill 80 by Representative Ortega from El Paso, and this was relating to a study and a report regarding the shortages in certain health professions, including audiologists and speech-language pathologists. The Texas Higher Education Coordinating Board, that is the one that approves higher education, college-level courses and programs, oftentimes will take a look to see which professions may have a shortage and what they may need to be doing to encouraging more schools, to be more applicants to produce more of these professions. So so the Higher Education Coordinating Board is instructed to do a study as it relates to most of the healthcare professions to find out where the supply and demand is, whether or not there are enough nurses or doctors or pharmacists or audiologists to meet the needs of patients in Texas. And so that's a bill that passed, and obviously we will follow that. We'll contact the people that are in charge of that and see if there's any way that we can help with their study. Second bill that passed was House Bill 125 by Representative Martinez from down in the valley in Weslaco. This is an interesting bill responding to a problem that other folks had. It requires, it actually prohibits any licensing agency from publishing the home address or information about certain licensed health professionals. And with all of the interesting protests that have gone on in communities about abortion or whether or not the death penalty and things like that, certain advocates have gone so far as to look for the home addresses of those doctors or those pharmacists or those professionals so that they can protest there. The privacy and the safety of your healthcare professionals had become a concern, and so there's now a law that would prohibit any licensing agency from publishing on their website home addresses or personal information of licensed professionals. House Bill 706 by Representative Bernal from San Antonio. This requires the Medicaid program to provide reimbursement through the SHARS program for school services provided by an audiologist. And now the SHARS program is a special reimbursement program for school districts that provide services to Medicaid eligible children that they can get reimbursed for those services through the Medicaid program. We all know that Medicaid reimbursement for audiology services is dismal and has been a very difficult issue for us to find increases there. But this will at least provide some incentive for school districts to provide audiology services for students that are eligible for Medicaid. We've been very concerned about the quality of those services due to the low reimbursement rate, but it's a start, and it's something certainly we'll work with on that. The last bill that passed that I wanted to tell you about was House Bill 2255 by Representative Darby out of San Angelo. This would require that the newborn and infant hearing screening results that are always done by the hospitals now be shared with the parents of the children. And obviously we know that any indications of a hearing loss in children must be referred for services, but the results weren't always shared with parents, and now they will be required to be shared. So those are the four bills that passed. We certainly had an interest in all of those. We didn't get actively involved in many of them. We've supported some and visited with the offices of the authors of each one of them to make sure we understood what they were trying to accomplish. What I'd like to talk about now is what those bills that did not pass this legislative session, and there were just three that I'm going to mention to you this morning. House Bill 2237 by Representative Goldman out of Fort Worth would have required audiologists who fit and dispense hearing devices to follow the same rules as fitters and dispensers. Now, this is a bill that never got a hearing and never went anywhere, and we're still going to need to follow up with Representative Goldman's office to find out if there was, in fact, a problem that they were trying to solve, who might have initiated this bill, but it's certainly not something that passed, but we certainly want to respond if there is a concern with audiologists who fit and dispense not following the same rules as fitters and dispensers. So we'll review that with the author and his staff and be prepared for that at another time. Another bill that didn't pass was Senate Bill 895 by Senator Zaffarini from down in Laredo. Now, this is an ongoing debate among those advocates within the hearing communities. I will tell you that the hearing loss community is not of one accord and does not always agree on what the right answers are to resolve these issues or to manage these issues. But an organization called Lead K has in fact filed legislation imposing their particular solutions in trying to impose those into law, and those have not passed. This was more of a collaborative effort on the part of many organizations that were at this point wanting to just collect data. So House Bill 895 would have required school districts to report data relating to language acquisition of children 8 years of age or younger to the Texas Education Agency so that data could be collected for the next couple of years, and that would be more helpful to further consideration of other pieces of legislation. That bill did not pass, but as you know, that discussion is always ongoing. The last bill that didn't pass was, of course, House Bill 2658 by Representative Julie Johnson of Dallas. This was our bill that would have allowed patients to choose a hearing device more expensive than the coverage and pay for the difference out of pocket. Kind of talked about this one already and talked about how that would have been a great bill, and we truly do believe that bill is going to pass next legislative session, but we just ran out of time and we got started a little bit late. So as you can see, it's imperative that any licensed healthcare professional in specific make sure that they're involved in the legislative process. I will tell you that while you are at home and busy in your practices and doing what you will, if you're not attending to what's happening up here at the Capitol, other people will come in, and before you know it, they'll be able to provide your services but not have to go through the same educational requirements or licensing requirements that you will. Or your competition will come in and will make changes to the law that are detrimental to your practice. So the legislature has tremendous influence over your practice. And that's really why I'm glad that you guys are here today, that you're already thinking about how you can be part of the leadership of your practice in the years to come. I will tell you that the effort that you're putting into being licensed and to learning a profession and to building a practice when you're done can all be adversely impacted if you do not decide today to dedicate a certain amount of your time and your talent to participating in the organization that represents you in Austin. So I would encourage you to stay involved in TAA, to plan on being a part of TAA as you develop your practice and move forward. And if it's not me, you need to have somebody at the Capitol that's going to be watching, being your ears and eyes, to be able to watch for what's going on up here. So thank you so much for taking the time to be here in Austin. It indicates to me that you have already a dedication to your future. And the legislative process is fascinating and wonderful. And I think I would also encourage you to get involved in the political process. These folks that are up here representing you back home, they're not audiologists, they're not healthcare practitioners, they're not necessarily anywhere knowledgeable about what it is that you do, but they are going to vote on how your future is going to be developed. So once again, thank you for being here, and thank you for being involved. I'm sorry that I'm not able to take questions from the audience, but please, I am always available. You can email me at brad@bradshields.com, and I will be more than glad to visit with you further about any issue, or if you want to come to Austin and spend a day with me, I would love that as well. So have a great meeting here in Austin. Thank you again for letting me do this via video, and y'all have a great time. Thank you so much.